Right, so I'm a dentist. I didn't qualify here. I came over and qualified and equated my degree. But along the same pathway that Ashwin and Dr. Zainab had to say is what a dentist would take in this country. Your personal statement, I understand, is really important. Your all-rounded development is equally important. Your interpersonal skills, your skills of being a team player, your ability to handle the interview, and all of this is just like Ashwin and Saidam had said, that your career pathway is not just with regards to the science or the field of interest that you're in, but as a person, how you're able to tackle day-to-day situations, how you're able to see people not just for what disease they present with, but see them as people and treat them as a whole. So there's a lot of skills that you would be assessed on just in your interview, not just for the science and capabilities that you have from school. So unlike education, I know we did not the best portrayal of what education could be in Kerala, but coming from an educational understanding of how things work in India, and where you're textbook learning and you're able to cram as much information into your head and you're able to repeat that information, it's different, where your ability to apply that in different situations to different people, to different patients, is what's really important. So dentistry is no different to what they've described. It's exactly the same. You go through your university, and once you finish there, unlike medicine where you have to do rotations, where in dentistry you would try and find a placement in a dental practice where there's a trainer. And this is known as foundation dentist training. So your FDR, your foundational dentist position is what you'd have to find, match up to positions that you'd like to go to. But again, it depends on your ratings from out of university and the position you're applying for, where you would get in. Now, once you've finished foundational dentistry, it's very different to medicine, because dentistry gives you that complete freedom of which direction you want to take yourself in. And so dentistry involves not just sticking to a hospital background, but as you understand, there are clinics, surgeries, practices, what you call it, where you can be an owner of a practice, you can be the principal dentist in the practice, you can go into the educational field to tutor in dentistry, you can go into research, but you can also go into the business side of dentistry, which is also very lucrative in the field of dentistry. Dentistry's got not just the aspect of healthcare, but also the field of being a field related to cosmetics as well. So it is a field where there's a lot of interpersonal skills that are almost like you're trying to help a patient with their condition, but the condition might not be a disease, but it might be something like they're not happy with their smile, or they're not happy with certain parts of how they view themselves. So dentistry has now evolved really quick, and digital dentistry is also becoming really popular. And I think it's a really exciting field that most of us are only going to get access to or understanding of in the next few years. I don't think there's anything specific I have to say about dentistry that's different to the process, because I think that's what's important today for parents and students to understand the process of how to get into dentistry. Is very similar to what Ashwin and Dr. Zainab had to say, but I was just giving it that different flair, which is different to medical practicing. So that's my take on it. Anybody has any questions? You'll have to, yeah, you have to do similar exams because that's what universities kind of understand it. Not just your student academics from your school, but like Ashwin said, these are different to what curriculum you're handling. It basically, what would you say? It gives you an idea of your intelligence and applicational skills. And so that's really important to them, not just whether you've absorbed all the curriculum. Yeah. I think it's more about training yourself towards that. Like Ashwin said, he trained himself within a book from Amazon. So